So one thing I tell families is, first of all, if you have any questions, snap a picture. We all live in the millennial age now. I used to have parents that would bring diapers to me that were like a day old. I remember working in the ER and I was like, okay, that's good. That's good. You can put that away now. We're all good now. But if you want to snap a picture and that doesn't have a smell that comes with it, I'm happy to take a look at it. Gosh knows how many phone pictures I have of baby's poop that's been sent to me by patients. But really anything goes besides red, white, or black. So red usually indicates blood, and blood can sometimes happen with a cow's milk protein allergy. So your pediatrician is going to want to know about that, but there's other things that can cause blood in the stools as well. So either way, never normal. Let your pediatrician know. White can sometimes happen when there's an issue with the liver or the bile ducts in a baby. So let the pediatrician know if you have questions about that. Black poop can sometimes happen also with blood, because actually when blood gets digested in the stomach acids, it can turn black sometimes. Or in the very beginning, when your baby's stool is very tarry and black, it's called meconium. And we expect that to go away, right? We call that the stools are transitioning to what we call the mustard yellow seedy stools. So if you're still seeing black that's persisting beyond a couple of days, we need to know about that too, because that's likely coinciding with feeding issues or the baby not gaining weight. Now, other things we've kind of hit on were the green frothy stools. A little bit of mucus is okay. Even just normal green poop is okay if your baby's doing just fine. I always tell parents it's not just their poop, but it's also how they're acting, how they're feeling, the consistency of the poop. So all of those things are totally fine. Another thing I want to point out is, since you said, is breast milk a laxative? So definitely breast milk is very highly and easily digestible. So once they drink the breast milk, it usually passes very quickly through the system. Doesn't mean that they're literally digesting the milk, because oftentimes babies have a gastrocolic reflex while you're feeding them and they poop. It's not that easily digestible. But what they're likely working on is the milk they had at the previous feed. So does that make sense? Or maybe if it's been like 2 hours since their last feed, they're likely have digested and worked on that and are stooling out whatever they've worked on from the last feed. So it's not a laxative per se, but it's very easily digestible. That being said, I've seen some babies who poop at every feed, and I've seen some babies who may not poop for up to 14 days, and parents really freak out about that. But as long as the baby's not really straining and they're doing fine, not uncomfortable with stool, and the stool doesn't appear to be, constipated, small balls, or, hard in texture, I'm not worried. So it can be really normal to have babies who don't stool as frequently as well.